Wilhelm, your co-host of Ageless Living here on Voice America and World Talk Radio, and we also have our amazing host, Dr. Lee, who has Western medicinal degrees, and she also has degrees to practice in China, where she's going to be visiting here in a few days.
Thank you.
You're very welcome. And we're also joined by Dr. Robledo, who, for those of you who are just tuning in, is the actual co-owner of our major sponsor on the show, Arizona Laser and Skin. If you want to find out after the show or during the show, if you want to go to the website, it's azmdlaser.com. And there you can look at before and after pictures. You can also, if you want to see somebody live, and some people think, well, on the website it must be contrived. It's really not. I've actually, these are real clients that they've given permission for their pictures to be shown up on the website. But I'm also a client, so not only am I the owner of Hair Club for Men, I'm kidding, but but I actually am a client of Arizona Laser and Skin as well. So I really appreciate the work that they've done. Part of the reason I know about the hydrocortisone cream that we were talking about before is my wife went and bought some off the shelf, and then I found out later not good for me. And then I was able to do some things that were good for me that I'll talk about in just a second. In particular, I had a really, on my nose, if anybody goes back about a year ago and looks at the Social Universe shows on YouTube, you'll be able to see that I had a mark right in between my eyes, and that I don't know if it made people lose concentration looking at me during that period of time, but it made me when I looked in the mirror. So I assumed there were people who would be talking to me, or I'd be talking to them, and they couldn't concentrate because of the big spot in the middle of my nose. But it's gone. And it wasn't the hydrocortisone cream. Thank goodness I stopped using it, and was able to use something not only that was effective, but something that was actually not bad for me at the same time. So thanks to Dr. Robledo. We'll talk more about that later. And that's kind of the area that we were talking about, that there's creams, there's different ways of utilizing anti-aging. And I'm going to turn the time back to Dr. Robledo, if that's okay.
Sure. As I was mentioning before, there are some topical things we can do to improve our skin and improve that age look. And one of them is creams, and there's creams that have different components. There's creams that have whitening agents in it, like kojic acid and hydroquinone. There's creams that have collagen in them. There's creams that have vitamin E and other antioxidants, and all these things can help to a certain degree. It's like there's no one thing that's going to give you everything you're looking for, but if used in combination with other kind of treatments, you will achieve that youthful, fresh look. Other things that we do for the skin to improve the texture, the thickness, help it produce more collagen, is treatments such as, like I mentioned before, photofacials or intense pulse lights. We do chemical peels. We do resurfacing with lasers, or just treatments with radiofrequency. And all of these devices and all these treatments are geared toward increasing the thickness and improving the quality of the collagen on the skin, the texture, getting rid of pigmentation, and this in itself will make you look fresher, younger.
I'm going to throw something out there, and then you can take issue with me if I'm wrong here. But the major science behind it is that that seems to be common among all of them, is that in a positive way that doesn't long-term damage your skin, it is actually going in there and causing your body to have your immune system go in there and reheal. In the process, it creates collagen.
Correct, and that is a key thing. So you have to have a good immune system. And you have to not have certain metabolic, illnesses that could cause for any of the treatments given to you with the purpose of making you look younger, so as not to let these treatments cause damage. What we do when we basically want to make the skin look more youthful and fresh, other than creams, we try to motivate, or we try to stimulate the skin to produce more collagen and to kind of repair itself. But by the same token, if you have a problem by which your skin cannot repair itself, instead of helping you, we're going to cause problems. So like for instance, we will not attempt treatments like chemical peels or skin resurfacing on people that have been taking retin-A type products, because these inhibit the ability of the skin to heal.
What are retin-A products?
These are products that are used to actually help improve acne problems and
so they're
Isn't
finding
it a
them.
type of vitamin A?
yes, it is. And we do need vitamin A, but
Oh, okay.
but in treatments like that, it will inhibit the skin's ability to repair itself, so we can cause abnormal healing and scarring when we traumatize the skin.
So if somebody's taking vitamin A and biotin in combination, something like that, is that bad or good? Is it relevant depending on?
I think it's topical.
Okay.
It's
Yeah,
not
okay.
something you take orally. It's
Okay.
topical.
You have me
It's
scared.
topical,
application.
yeah.
No.
And then of course, if you have some kind of immune disease, or we cannot treat you also because your body is not going to respond adequately. The inflammation.
This is why it's important to have a consultation.
Absolutely.
You bet.
And that's one thing we always do. We will always sit down first with a patient. Doesn't matter what simple treatment they're pursuing. They can come in for a simple thing like microdermabrasion, but we need to know that their skin is going to react the way we expect it to, and they don't have some kind of systemic disease or illness that's going to keep them from reacting the way they should or healing the way they should.
If I could use this as a moment to explain what is unique about Arizona Laser and Skin, is that when you go into that consultation, you're going to be able to be overseen by an actual physician like Dr. Robledo or Dr. Lee. And many times when you go into a med spa, you're seen by a technician or less who may have no certifications at all. And then the criterion is, do you have money? And you want to be a little bit careful about that. You want to be seen under the care of a physician. So if you're a little bit worried that maybe some of the treatments didn't work out as well as you wanted to at your own med spa, you may want to come for a second consultation, just for a second opinion down to Arizona Laser and Skin.
That's correct. On occasions, besides one of the physicians, we may have our nurse do a preliminary evaluation, but this is always later on passed on to one of us.
Sure, absolutely. Very important. And when I want to also, other med spas might say, well, we do have a physician overseeing as well, but ask a little bit deeper, because sometimes they show up once a week. So the entire med spa operates under the auspices of a physician that shows up for an hour each week. You just want to double check that, and that's one of the things that makes Arizona Laser and Skin unique. So that's one of the other things I was going to ask is the microneedling. That's something that seemed to work really well for me, and in combination with something else. I'll wait till you talk about it in a moment.
Sure. As I mentioned before, there are many things that we can do to improve the skin texture, help thicken the skin, produce more collagen, improve the pigmentation. Other things that we can provide is, besides the treatments to take care of pigmentation, we can provide treatments to thicken the collagen layer. And we use simple things sometimes like microneedle rollers. And microneedle rollers is a very good treatment that is blind to any skin color. That means it can be used on any type of skin color. And it is very effective in producing collagen and getting rid of lines and wrinkles. We use this sometimes in combination with other treatments for the pigmentation. Of course, we can use things more aggressive like CO2 fractional laser, which you have had done before.
Absolutely.
And that is a little bit more aggressive. Same purpose, to produce collagen. It also helps to improve pigmentation and texture at the same time. We have other treatments. Levolon is aminolevulonic acid that we apply, and then we activate it with a special blue light. And this is like a sort of chemical peel. And the purpose also to help improve the pigmentation, get rid of sun damage. And by the way, it gets rid of precancerous skin cells also.
That's a huge benefit.
It is a big benefit.
Very big benefit.
A couple of things, if you don't mind, since I've had all three of those treatments, just to kind of talk about the personal experience behind it is, with the Levelon. Levelon is actually what lifted that big brown spot off my nose. For all I know, it was precancerous. I don't know, but it disappeared.
You never know.
And I actually had a lot of age spots around the sides of my eyes, and also where I had a lot of sunburning up on my forehead. I grew up on a ranch, a cowboy in the background of my life, growing up on a farm and a ranch, and so obviously saw a lot of sun. I also was anti-cowboy hat. I don't know why, so my skin.
It covers your beautiful hair.
Yeah, that must have been what it was. There used to be more of it. But it was, obviously I'm a perfect candidate for somebody who has aging skin. However, it was surprising how much my skin didn't age as much abuse as I gave it. But the Levelon was kind of the first treatment that I had, and a lot of the brown spots came off. The important thing about that, in case you think, well, the brown spots, people don't really notice them. I think I used this example before, that we were watching Snow White and the Huntsman, and my wife pointed out that Charlize Theron, who is the actress in there, is a very beautiful actress. The only thing they did to age her, which made her look 60 versus, late 20s, early 30s, I don't know what her actual age is, but she they put age spots on her face, and she really did look 60, a fit 60, but she looked 60.
Sure.
And so taking those age spots off, it's a much bigger deal than you might think. So I was really grateful for that coming off. And then there was some stimulation of collagen. People did comment about how I looked younger to that effect. Then later on down the road, we did the microneedling, and then right after that, we did the CO2 fractional laser. And I'm telling you, I mean, sometimes you see yourself in the mirror so often every day that you don't realize these small gradual changes, and you have to look at a picture of what you look like before and then a picture after. So even before and after picture, people get a little bit surprised. They don't realize how much progress they actually made. But with me, I noticed it. I looked in the mirror, and my wife's like, "What, are you falling in love with yourself?" But I mean, but I was just amazed that my skin looked at least 10 years younger. It really did. And if any of you don't believe me, then just go back a few months ago from the date of the show, and you were able to tell literally in my face that my skin, at least, maybe not the entire rest of me, but my skin looks 10 years younger than it did before.
But we can
Very
tell because
amazing.
we have the before and afters.
Yes, and if anybody wants to, we may have to release them to the website where you guys can all take a look. Overall experience I want to share with you is I did the deep Levelon. So that did take 4 or 5 days for recovery. I did it during the holiday season, so the entire world didn't see me on the air and things of that nature. So that took some downtime. The microneedling was 2 hours of redness and went away. And so there's almost zero downtime. You can do it in the evening and be done. And then also I did the CO2 fractional laser, which somebody did see me in the evening, and the most graphic part of it was that they put Vaseline on just for good measure to keep it moist. And so somebody said, "Looks like you're sweating. Did you come back from the gym?" So that's the only comment that I got. And people actually, a couple of people did see me in the evenings, and it wasn't this drastic thing. The next day, all it did is look a little bit like maybe I'd gotten sunburned the day before. So you really can go to work the next day. Ideally, I guess you do it on a Friday afternoon, and then by Monday there's almost no.
But there's very little downtime for the CO2, low energy.
Absolutely. So I loved it, and it was the low energy, by the way. So I mean, who knows? At some point, I might talk you guys into doing the deeper CO2 fractional.
It goes like, the more aggressive you go, the better results you get. It's one of those things. You have to pay for the downtime in order to get the best results. But what we say is, you give us 7 days of downtime, you get 7-10 years younger look. Yeah,
it's amazing. And I didn't believe it. And okay, I just have to share this one thing. Is it time for break? Are we getting close? It looks like we're getting close to break. When we come back for the break, I'm going to give you an amazing quote from somebody who really matters to me. So don't go away. When we come back from break, we'll learn more about it. This is Kurt Wilhelm, your host of the Ageless Living Show here on Voice America World Talk Radio, joined by
Dr. Tony. We'll be right back.
See you after the break.